Dr. Senator Al is on number 9.
Thank you, Dr. Watson. Thank you, Senator Thompson, for coming to present. I have a couple of questions. Some of them are fairly granular, so I appreciate you walking me through this bill. The first question is on line 25. It includes 3 medications in this list: mifepristone, misoprostol, and methotrexate. Later on in the bill, in line 85 and 86, it says that these drugs do not treat ectopic pregnancies. However, we know that methotrexate is often used to treat non-ruptured ectopic pregnancies. So that's actually incorrect.
So again, the bill's not perfect, and we say we're going to
Right, so
accept
okay, so
amendments.
when
We
we-
talked
when we
about
revise,
this.
we probably should
Gotcha.
take
Thank
that out
you.
because that's not correct. Sorry, I have a couple more questions. Next thing, in the listing of line 76, it says the abortion-inducing drug should only be provided or prescribed by a qualified physician. This is based on, I believe, you presented some 2016 REMS data. Are you aware that in 2017, the FDA gave an update for the use of mifepristone that says that APPs, that is advanced practice nurses, physician assistants, and other mid-level providers like midwives can prescribe mifepristone? So we probably need to.
So in
Update that.
2019, they did an update on that also. So I got you
So
again.
that's-
Got you.
that's
Thank you.
Probably needs to be corrected. So just a couple more things that are very practice related. Next thing, line 98 says a qualified physician providing abortion-inducing drug must be credentialed and competent to handle complication management, including emergency transfer. Does this, to your understanding of the bill, include admitting privileges? Yes. Are you aware that previous Supreme Court cases have found that requiring admitting privileges for providing abortion care is unconstitutional?
So that is not specific in that language. And
May
so
wanna
if
clarify
a
that.
person has a follow-up, I mean, that's going to be a matter of interpretation. That's going to be a person with follow-up. And the follow-up or complication relating to that the person prescribing this would have someone on call, or they would be doing it themselves, or they would have a relationship with the emergency room and so forth.
Given that there's confusion, that probably bears some clearing up. One other thing, line 105, it discusses an appropriate follow-up visit. Can this follow-up visit be done via telemedicine? I think is appropriate, but not clarified.
That would be up to the discretion of the doctor. Appropriate is an intentionally vague term, because it's up to the physician's discretion. If they talk to the woman and she indicates that she's had a high degree of bleeding or other complications, then they'll ask her to come in. But that would be up to their discretion.
I appreciate you leaving that to the physician's discretion. One final question related to line 118 that restricts provision of these medications in institutions of higher education in the state. First part, does this include private universities? And second question, does this include university hospitals, such as, for example, Emory University Hospital?
It would not include a hospital. Institutions of higher education would be colleges and universities. The hospital, I believe, would be
Institutions
excluded.
of higher education. I would probably bear some clarification because that has some major implications for patient care.
All right.
Thank you.
Thank you,
Appreciate it.
Dr. Al. All right. We have other questions.